Hi guys, I'm Becky, and my topic for discussion is pneumonia. So I made a picture for you and I'm going to explain it now. Okay, so this is pneumonia. I've got my happy lung and my sad lung. The sad lung has fluid and bacteria or viral components inside their alveolar sacs. That's what that green and yellow yucky is. People with pneumonia, their signs and symptoms are cough, productive or non-productive, trouble breathing, increased respiratory rate, fatigue, fever, malaise, general not feeling well, low O2 sats, under 95. I just wanted to go over, there's bacterial, viral, fungal causes, and there's also aspiration pneumonia. Aspiration pneumonia is when food or fluids go into the lungs where they're not supposed to be and they create an infection. Prevention would be making sure you have the proper team members involved in their care so they can do an eval, educating and demonstrating food and fluid alternating, clearing their throat, proper consistency. People that have risk factors for aspiration pneumonia have stroke, cognitive disability, dementia, COPD, and history of smoking. To prevent this, which can be deadly, pneumonia can be deadly, especially for the very young and the very old. Prevention is number one is hand hygiene. They do have a vaccine for pneumonia, which is given mostly to the elderly, and healthy diet and lifestyle will also help combat against getting pneumonia. You can get community-acquired pneumonia, hospital or healthcare facility-acquired pneumonia. Those are pretty general, just it's where you get it. Treatment is with antibiotics, antivirals, antifungals, and also oxygen therapy as indicated. People with compromised immune systems are really at risk. People with diabetes, if they've had a history of smoking, if they have COPD, they're chronically ill. That's a lot of those people end up getting pneumonia a lot. And there's easy ways to prevent it or to try to make it less debilitating than it can be. So for the nursing process, assessment, you're just going to do a full respiratory assessment with lung sounds. You're just really going to look over your patient and see where they need help. Diagnosis is done with a chest x-ray, cultures of the blood or sputum. You're looking for increased white blood cells if their ABGs are off. If they have a fever. Planning, you're going to plan their activities with minimal exertion. You want to make sure that they're getting as much oxygen as they can because they're really not feeling well. You're going to want to implement some really good patient education on their medication if they're going to be starting it. This could be neb treatments, antibiotics, antivirals, inhalers, oxygen therapy if they've never been on it, using an incentive spirometer, and deep breathing exercises or something like a flutter valve to help them cough out those particles or fluids that they can't get out. Evaluation. To evaluate, we're going to do repeat blood work, cultures after medication administration. If they're displaying that they can tolerate activities better, their vital signs are back to baseline, and we're going to discharge them home with proper education. These people also, like I said, antibiotics and all the medications, but they can also take things like mucolytics to help them get that bad stuff out, and hopefully make them feel better pretty quickly. So that is pneumonia. Thank you.